When my senior year of college was cut short, I was lucky enough to be quarantining with my 102-year-old grandfather, Philip Vassar, and I found myself talking to him frequently about the pandemic that ravaged our country the year he was born, the 1918 influenza pandemic, also known as the Spanish flu. We know that health conditions were much poorer in the Black community at that historical moment. In 1915, there was a 16-year difference in life expectancy between white and Black Americans. The combination of poverty and racial prejudice often rendered healthcare inaccessible. In 1918, legalized segregation barred Black patients and Black medical professionals from accessing most hospitals and healthcare facilities. And on the whole, white nurses and physicians refused to treat Black patients. So, while the 1918 pandemic reached every level of society, spanning geography, class, and race, the ultimate impact was felt most harshly in the most vulnerable and marginalized communities. I spoke to historian Dr. Nancy Bristow. She said, "Tragically, when I talk with people about the similarities between the pandemics, I immediately go to this resonance. I see very little difference. Those who are in marginalized communities in 1918 and 2020 are in both cases suffering desperately. So, in 2020, we're seeing the same thing play out, which is shocking in a nation with such modern healthcare, one of the richest nations in the world, that we could be experiencing a pandemic and allowing the same kind of inequities based in class and in race and ethnicity to play out." So I'd really like to thank the Counsel for Our Cause and the American Heart Association for fighting to ensure that history does not have to repeat itself.